everyone! I am back again for another episode of endometriosis. My name is Leng Tan. I am a trainer, I am a consultant, I am a wife, I am a daughter, I'm a friend, and I'm going to be a mother. I don't know when, but I'm sure that it'll happen. And just like what I have been saying in the past videos, it is difficult, or conceiving is difficult because of my condition, which is called the endometriosis. And I am back again to talk about endometriosis. This is episode 5, and in the previous videos I talked about what endometriosis is, what are the 6 facts about endometriosis. I talked about the signs and symptoms and the causes. And for this episode, I will talk about how endometriosis is diagnosed. Now, there are 4 main ways on how to diagnose endometriosis, and out of the 4, I have gone through 3. Okay, the first, which is the easiest and the non-invasive one, would be the review of the signs and symptoms. When a woman comes to the doctor complaining about signs and symptoms, not being able to conceive, experiencing severe period pains, excessive bleeding, and all of those signs and symptoms that I mentioned the last time, the first thing that the doctor would do is to review these and check if these are all related to endometriosis. After that would be the second way to diagnose endometriosis, which is a pelvic exam, or where the doctor will insert about a digit or 2 into a woman's vagina and check or palpate for lumps and cysts around the genital area. Now, sometimes they are able to detect cysts, but most of the time they don't, because the only thing that they will be able to feel is if the endometriosis is around the area, the vaginal canal, or the cervix, or some parts of the uterus. But if the endometriosis is located someplace else, then the pelvic exam will prove to be ineffective. Hence, the third way of diagnosing endometriosis, which is ultrasound. More specifically, transvaginal ultrasound, where a probe wrapped in a condom will be inserted inside a woman's vagina, where the doctor can check all other reproductive organs, such as the ovaries, the fallopian tubes, the uterus, and the cervix. In my case, this is what helped my doctor diagnose my endometriosis, because my endometriosis was found in my left ovary, and that facilitated faster diagnosis for me. However, for some women, the endometriosis cannot be found in the reproductive area. It can be found in other places, such as the stomach or anywhere in the abdomen. Hence, the fourth way of diagnosing endometriosis, which is surgery. More specifically, laparoscopy, wherein an incision will be made in the belly button and a scope or a camera will be inserted through the opening, so that the surgeon can view your insides and check for presence of endometriosis, wherein cells which are similar to the cells found in your uterus are detected in the different areas in the abdomen. And sometimes during laparoscopy, the doctor can extract pieces of endometriosis and have it taken for biopsy to check and confirm if it really is endometriosis or a tumor, which can be either malignant or benign. As for myself, I have gone through the review of signs and symptoms, pelvic exam, as well as ultrasound, all of which have been very, very painful. But I've been lucky as to not to go through surgery as of yet. So those are the 4 ways on how to confirm if a woman really does have endometriosis. Thank you for watching. Again, if you have questions about endometriosis, please do not forget to ask me in the comment section. Use the hashtag LengSpeaksEndo. And also, please join the Facebook group Endometriosis Philippines if you want to find more information about endometriosis and discuss other concerns about endometriosis. Right? Please like and share the video. Thank you for watching. I'll see you in the next episode.